Good morning, or afternoon as the case may be. We are here to do the second session of BAP. Last time we were together we talked about MI, particularly, that's motivational interviewing, particularly the spirit of MI and why that's so important and why that's foundational to brief action planning. So we're not going to spend a whole lot of time on that. I'm just going to do a quick going over that again real quickly, but then we're going to kind of move into the guts of BAP. All right? So what is BAP? Brief action planning is, it really is highly structured. And there are some things I like about that and some things I don't like about that. The good news is, particularly for clinicians, is that it's something that's pretty easy to get your arms around. You can do this with relatively little training. So it is highly structured. It's kind of, you learn 3 questions and 5 skills, and if you can put all that stuff together, you're doing BAP. So from that aspect, it's nice. The thing that I don't like so much about the structured part is that there may be things or skills that you need that you kind of need to bring in from your motivational interviewing training, which is why I would encourage you all to get more. But you have to bring in some of those questions sometimes from motivational interviewing to help you kind of bridge the gap sometimes in BAP. And if you don't, it can be, BAP can be, ask this question and you're waiting for the answer. It kind of puts you back in that expert role. But the good news is that it is completely designed to bring in the spirit of MI. So it's really built in to BAP. So that's the good news. It is patient-centered. So in that aspect, we mean that these are the patient's ideas. We're evoking those ideas from the patient. It's not our agenda, not our ideas. It's really about the patient. It's a stepped care approach. So like stepped care approaches for hypertension or diabetes, there are things that you can kind of add in here. You don't have to use the whole thing, but if you need more skills, they're there. You can add them in. And it's certainly evidence-based. Action planning has been around for a while now. It's an outgrowth of a psychiatrist actually named Stephen Cole, if you want to learn more. But it's a self-management support technique based on the principles of MI. So we will start there. And just to recap from last time, remember with MI we always put on our cape, right? So our compassion, giving the patient autonomy, that idea of acceptance. Remember, acceptance doesn't necessarily mean that you agree, but you accept the patient where they are. You encourage their autonomy. You work together in partnership. This is 2 experts coming together, not you're being the expert and them being the novice, or, God forbid, you being the parent and them being the child, right? So we want to keep away from this and move it more to a collaboration, a real partnership together. And then the last thing is evoking, right? So you're listening for those things that are coming actually from the patient, their motivations, their ideas, and so forth, right? All right. So one of the things that I think we make a mistake about is oftentimes when a patient will call our office and make an appointment and come in and see us and sit down in front of us, we figure they're ready to change. I don't think that's particularly true all of the time. I think probably 10 to 15% of the time, patients come in ready to change. The other, they're ambivalent, right? So we talked a little bit about that last time, but they're not really sure if they're ready to change or not. That's where MI comes in. BAP really is for those patients who are ready to make a change. It's the first question. Is there anything you want to do about your health in the next week or 2? So those folks, it's almost a culling process or a filtering process that lets you know that those folks are ready to change, which is a great thing to know, right? So they don't always come in like this. And as we think about Prochaska and De Clementi and the stages of change, what we're really talking about is a lot of people are in that pre-contemplation, contemplation phase where they haven't made really the decision if they're going to make this change or not. When they are ready to make that change, they're well into contemplation, and then they've probably done some preparation and are really ready to take some action. So that's kind of the difference between MI, I think, and BAP in lots of ways. So, how often would you use this? So if you're in a busy primary care practice and you're seeing 20 folks a day, maybe 50% of the time you're going to get to question 1, which is that question, is there anything about your health that you'd like to change over the next week or two? So you maybe do that in half the patients. Of those, about 25% won't be ready to change for one reason or another, and there's lots of reasons for that. Maybe they haven't thought it through, maybe they're just not interested, maybe they're healthy and they feel okay where they are, and that's okay too. So that's maybe 2 or 3 patients. 2 or 3 patients, or again a total of 10 to 15% of your patients, will be ready to make a plan. So that's kind of the simple BAP plan. Some folks will need to talk about this a little bit more. You're going to need to evoke from them a little bit more some of their ideas about the things that they might want to think about in terms of changing, or do some problem solving. And then about 25% are actually going to need more advanced skills. You're going to need to bring them back, you might need to refer them, you may need to use more advanced MI techniques and this sort of thing. So again, if somebody's not ready to change, what are we going to do? We're going to force them, right? No. We're going to back away a little bit, take a deep breath and say, that's great, you know, only you are the one that can make that decision. And we respect their autonomy and say, if it's okay then, maybe next time we see, would it be okay to bring this back up? And again, they can say yes or no. Right? So, folks that are ready to make a plan, okay, let's do brief action planning. Terrific. The folks that need a little bit more time, either I would call this advanced BAP and kind of using all of the skills that we'll be learning briefly today, or they may need some more time to think about this and work through it, and you can help them with some of your great MI skills. If they need advanced skills, then that's probably a referral, possibly, or you may just want to have them back and say, this is really important stuff, would it be okay if we schedule another appointment in 2 weeks, or whatever you want to do. Right. I'm going to stop here because we would like to show you a brief video just to kind of give you an overview of what BAP is about. Okay?